I beg you to grant my soul its proper taqwa and to refine it.
Alhamdulillahi Rabbil Alameen, wassalatu wassalamu ala sayyidil anbiya'i wal mursaleen. Amma ba'd, fa'a'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. As-salatu wassalamu alayka ya Rasulallah wa ala alika wa ashabika ya Habiballah. As-salatu wassalamu alayka ya Nabiyallah wa ala alika wa ashabika ya Nur Allah. My dear Islamic brothers and viewers of Madani Channel, there are countless benefits of reciting Durood and Salam on the best of creation, the seal of prophethood, peace of our heart and mind, the most generous and kind Sallallahu Ta'ala alayhi wa alihi wasallam. He Sallallahu Ta'ala alayhi wa alihi wasallam is reported to have said that whoever recites Salat upon me 3 times in a day and 3 times in the night, showing devotion and affection towards me, it is upon the mercy of Allah Azza wa Jal to forgive the sins he committed during that day and night. Sallu ala al-Habib sallallahu ta'ala ala Muhammad sallallahu ta'ala alayhi wa alihi wasallam. Welcome to our silsila, The Burning Issues. In this silsila, we try to learn about important social aspects of our daily life that have significant impact, not just on an individual, but also on the family unit, the wider community, and the nation as a whole. The aim of this silsila is to develop a basic understanding of these issues so that we can bring a change within us, a change that will be positive, leading to peace and tranquility in our homes and in our neighborhood. My dear Islamic brothers and viewers of Madani Channel, so far you have seen 10 episodes of our new silsila, The Burning Issues. In these episodes we have learnt about 6 different burning issues, which included when do children start learning, consequences of leaving your children unsupervised, importance of parents as role models for their children, the mind of a teenager, misuse of drugs. The last of the burning issue that I started discussing in the previous episode is the elderly. This episode is the second part of this topic. In the first episode of the elderly, we learnt about different criterion used to define old age, some important statistics related to the elderly people, and the views of society as a whole about elderly people, and most importantly, how elderly people are perceived by the healthcare professionals who are involved in their care. May Allah Azza wa Jal give us the ability to understand the value of our elderly, and may we serve them in the best manner possible to earn a great reward in the world hereafter that has been promised to the believers by Allah Azza wa Jal. In this second episode, we'll try to learn about the physical and mental health problems which afflict the elderly. The aim of this topic will be for us to realize the importance and value of elderly people, and so that we can treat them nicely. One day we will also get old. As the saying goes, what you sow today, so shall you reap tomorrow. How we treat our elderly, we are setting a role model for our children to do the same to us. Our children, they will learn this behavior from us, and when we get old, they will use this role model and treat us in the same manner. My dear Islam brothers and viewers of Madani Channel, human body is a wonderful creation of Allah Azza wa Jal. It is divine wisdom of Allah Azza wa Jal that as we age, there is a natural decline in all of the functions of the body. It is as if our body has been programmed to prepare itself for death. Everyone knows and understands that elderly people, they suffer from all forms of health problems, many of which are long-term in nature. A long-term condition is any medical condition that cannot currently be cured but can be managed with the use of medication or other therapies. This is in contrast to the acute condition, which typically have a limited duration, such as chest infection or a hernia or a mild episode of depression. Common long-term conditions include diabetes, some lung diseases like chronic obstructive pulmonary disease, known as COPD, chronic heart failure, osteoporosis, dementia. Most of these long-term conditions are more prevalent in older age groups. For example, the prevalence of diabetes, it rises steadily with age in men and women, and peaking at 22% for men and 17% for women in their 80s. What this means, those men who are 80 years of age, 22 out of 100 will have diabetes. And those women who are 80 years of age, 17 out of 100 will have diabetes. It is also estimated that 40% of people over the age of 65 and almost 70% of people over the age of 85, they have one form or another form of long-term illness. 16 million adults, they were admitted to hospital in England in 2014 to 2015. And of these, almost half were above the age of 65. Let us now learn about both physical and mental health problems experienced by the elderly. I will first talk about the physical health problems. My dear Islamic brothers and viewers of Madani Channel, try to imagine for yourself, close your eyes and imagine for yourself that when we get ill or develop a physical health problem, how inconvenient it becomes for us, how our mood changes, we become angry and irritable, and how we are unable to function normally. We adopt the sick role behavior and expect others to show sympathy towards us and help us with our activities of daily living. Try to imagine at least the same for these elderly individuals as well. Due to their advanced age, they are in a much worse situation than us. They are more dependent upon others, even when they are well, let alone in poor physical health. The physiological decline in aging refers to the physical changes an individual experiences because of the decline in normal functioning of the body, resulting in poor mobility, you can't walk properly, poor vision, you cannot see properly, reduced hearing, you obviously need someone to speak loudly for you to hear, inability to eat and digest food properly, a decline in memory, the inability to control certain physiological functions, and various chronic conditions. As we age, we become weaker and weaker, a term commonly referred to as frailty. Frailty is a distinctive health state related to the aging process in which multiple body systems, they gradually lose their built-in reserves. Frailty includes weight loss, it includes reduced muscle strength, it includes reduced gait speed, you cannot walk normally, and self-reported exhaustion. You feel very tired, loss of hearing, low mood, problems with memory. A person with frailty is more vulnerable to illness and typically presents with a geriatric syndrome such as falls, reduced mobility, confusion, incontinence. The most widespread conditions affecting those who are over the age of 65 and older, they include arthritis, heart disease, stroke, cancer, pneumonia, and flu. These are possibly the most common ones. Accidents, especially falls, that result in hip fractures, very painful. are also unfortunately common in the elderly. A lot of our elders are coping with at least one of these conditions, and many are dealing with two or more of the following physical health problems. First of all, heart conditions like high blood pressure, heart failure. That is when heart cannot pump the blood efficiently, and this leads to poor supply of oxygen and accumulation of fluids in different parts of the body, especially legs and feet. Which is why, people who are of old age, their feet will swell, their legs will swell. This is because their heart is not pumping blood effectively. Other heart conditions like angina. This is when they have these painful chest pains, episodes of chest pain that come and go. These can then lead to heart attacks. So these are the common heart conditions that elderly people suffer. Another very, very important and possibly the most embarrassing condition, incontinence of both urine and bowels. This is when people lose control over their bladder and bowel function, causing them to wet themselves or soil themselves. This clearly affects their dignity tremendously, and also leads to a lot of carers strain, those who are looking after them. This is also a biggest problem as well. Incontinent issues can develop as early as mid-50s, and they can lead to significant disruption of social activities and significant psychological issues in the form of embarrassment and low self-esteem. Arthritis, especially wear and tear arthritis, which is called as osteoarthritis, is another debilitating condition. It mainly affects hip and knee joints and causes a lot of pain, which makes mobility a challenge. And obviously lack of mobility, not being able to move around properly, causes a huge amount of restrictions on the daily routine of elderly people. Osteoporosis. This is another condition. This is low density of bones, in other words called brittle bones. Women are at higher risk of osteoporosis than men. When the bones are brittle, they fracture easily, even at the smallest amount of trauma. This is why when elderly people have a fall, they may end up fracturing their hip, causing significant amount of disability in many elderly people. And usually after hip fractures, most of them are likely to become disabled in one way or another. Diabetes is a major long-term condition which affects up to 20% of elderly population. Diabetes, it can have short-term complications such as high blood glucose levels, causing what we call as diabetic ketoacidosis, which can be life-threatening condition. On the other side, low blood glucose levels called hypoglycemic attack, or simply a hypo, it can be fatal if not treated immediately. Long-term complications of diabetes, they include problems with most of the bodily organs, causing blindness, kidney failure, sensation problems both in the hands and the feet, and increased risk of strokes and heart attacks. Breathing problems. They can be due to either lungs losing their elasticity and not expanding as well. Thus, they cannot provide enough oxygen. Those people who have been smokers for many years, they can develop COPD, which eventually requires artificial oxygen supply to help them breathe more effectively. These individuals are prone to frequent exacerbations of their COPD due to multiple chest infections, especially in the cold weather. Breathing difficulties, they cause significant morbidity in the elderly as it significantly impairs their physical activities, and they will struggle to maintain the most basic activities of daily living, for example, changing their clothes or going out to buy food even from the local shops. When it comes to walking, we need at least 3 systems of our body working in coordination. This includes visual system, balance system in our inner ear. You may feel it surprising, but the balance system of the body is actually based inside, deep into our ears. And sensation, especially in our feet. Unfortunately, with increasing age, elderly people face problems with all these 3 systems. Poor vision, poor balance, and poor sensation, they all lead to frequent falls. Every year, about 1/3 of those who are 65 years or older, and over half of those who are 85 years or older, they fall. Falls are the leading cause of injury and death for older people. Falls can actually be fatal in the elderly when they cause bleeding in their head. Falls can also cause fractures of bones, especially hips, shoulders, and wrist. One other problem with falls is the elderly people will not be able to get back up on their own. Those who live on their own, it is not uncommon for them to remain lying on the floor until someone comes to help them out. This can lead to a condition called rhabdomyolysis, which results from the breakdown of muscle due to lying in one particular condition for a longer period of time. And if after the fall they happen to lie against a warm surface such as central heating radiator, then this can cause a significant burn injuries of different severities. Parkinson's disease is a neurological condition which affects the tone of our muscles, and it is characterized by stiffness, tremor, and very stooped posture, slurred speech, and marked slowness. You will be able to notice someone who's suffering with Parkinson's disease, how their body is bent, how they're shuffling in terms of taking their gaits, and how slow they are. This is known as Parkinson's disease. Parkinson's disease, it mostly develops in old age, and it significantly interferes with an individual's independence. Eventually, these individuals who suffer with Parkinson's disease, they will require full-time care to meet their basic needs. As we age, our sleep gets less in both quantity and quality. Deep sleep goes down to about 5%. For elderly people who live in a joint family, their lack of sleep at night can be particularly troublesome to other family members who can get woken up by their coughing or their need to go to toilet. Our eyes are a major blessing with which we enjoy most of the bounties of this world. Bounties showered upon us by Allah Azza wa Jal. Only a blind person or an elderly person can truly appreciate this blessing. Eye problems in the elderly, they are common as well. These can include cataracts, glaucoma, macular degeneration. All of these actually cause poor vision. Another common problem that is found with age in terms of vision is presbyopia, which is when your eyes gradually lose the ability to see things that are nearby. This can occur by the age of 50, and it hinders reading, especially of small print in low light conditions. Speed with which an individual reads and the ability to locate objects may also be impaired. And by the age of 80, more than half of elderly population either have a cataracts or have had cataract surgery. Visual problems are another major cause of multiple problems in the elderly. As we age, we begin to lose weight for multiple reasons. This could be due to digestive system problems, poor dentition, and reduced production of saliva. They clearly cause major problems with chewing of the food, and this significantly restricts the type of food elderly people can eat. Taste buds on our tongue, they diminish So that by the age of 80, taste buds are down to 50% of their normal size or normal quantity. Food becomes less appealing, and as a result of this, nutrition can suffer. And about 40% of the time, old age is marked by digestive disorders such as difficulty in swallowing, inability to eat enough and to absorb nutrition, and then it can lead to constipation. And there are also bleeding problems in the digestive system, either in the stomach or from the back passage. Another problem with the elderly, which is actually normal part of aging, it is not actually a disease in itself, it is called essential tremor, an uncontrolled shaking in upper parts of the body. This is not part of Parkinson's disease. It is more common in the elderly, and symptoms worsen with age. You might have seen an elderly people when they drink a cup of tea using the saucer, and how it creates that constant noise because their hand is shaking. And obviously this shaking of the hands, arms and neck, sometimes their neck actually shakes, can make consumption of food very difficult, can even make drinking water very difficult. And then mental health disorders like depression and dementia can also be major cause of reduced appetite and weight loss in the elderly. This weight reduction will actually make them feel weak and also less resistant to fight infections. Over the age of 85, thirst perception also decreases, such that 41% of the elderly drink insufficiently. This can easily lead to dehydration, confusion, increased risk of water infections and kidney failure in the elderly. Other issues with old age in terms of physical health problems, they include weak immune system, which makes elderly people prone to develop infections, which can cause confusion and in some cases can be life-threatening. The reaction times of elderly people, they are slower, which is especially important if they are still driving or they are cooking for themselves. Their skin becomes thin and wrinkled, which can easily lead to bruising, skin tears and wounds that heal very slowly, or in some cases develop into deep ulcers. Elderly people, they commonly develop hearing difficulties, which significantly affects their daily functioning. By the age of 75 and older, 48% of men and 37% of women, they encounter impairments in hearing. In the 70 to 79 age range, the incidence of partial hearing loss affecting communication rises to 65%. Pain from different sources can be debilitating for the elderly. Pain afflicts old people at least 25% of the time. For example, there are 24 hours in a day. They could be spending 6 hours in a day in pain. And this can increase with age up to 80% of the time in those who are living in nursing homes. In addition to all of the above mentioned problems, elderly people, they usually take multiple medications for different diseases. And these medications, they have their own side effects, which requires close monitoring by doctors. My dear Islamic brothers and viewers of Madani Channel, this was a brief snapshot of some of the physical health issues that old age brings with it, and elderly people have to put up with all of this. Imagine that if you were suffering from all these problems, what will be your state of mind? Try to put yourself in the shoes of the elderly people. Try to empathize with them and develop an understanding of their difficulties and treat them with respect, treat them with dignity, treat them with passion and look after them well. This will be good means of gaining pleasure of Allah Azza wa Jal, and also you will be in this state one day. Jaisa karoge, vaisa bharoge. What you sow today, so shall you reap tomorrow. Let us now move to the second section of this episode, and that is mental health problems faced by the elderly. This is probably the most ignored aspect, and we have very little understanding of how mental health problems can affect everyone. Physical pain, it can be seen. People can accept it and understand it. But emotional pain is invisible. It is often most difficult to understand, and it has maximum impact on the individual experiencing this trauma, and situation is further exacerbated by the carers and family members who cannot understand why their elderly parent is angry, upset, sad, tearful, and sometimes verbally or even physically aggressive. This is all the result of mental health issues these people are suffering from. A little understanding on our part of these mental health problems can go a long way in terms of maintaining a happy and meaningful relation with them. And I hope that this segment will be really useful for us all. Let us look at some of the psychological problems or mental health problems in the elderly. Why do they actually suffer from these mental health problems? There was a famous psychologist. He developed a theory which was called stages of psychological development. And he stated that the human personality is developed in a series of 8 stages that take place from the time of birth, and it continues throughout an individual's complete life. This theory characterizes old age as a period of integrity versus despair. What does this mean? That when an individual reaches this stage, it doesn't actually bound it by a particular age. But when you reach this stage of integrity versus despair, you focus on reflecting back on your life. Those who are unsuccessful during this phase, they will feel that their life has been wasted, and they will experience many regrets. People could analyze their life in terms of how successful they have been in their career, how successful they have been in terms of raising their children, how successful they have been in terms of relationship with their brothers and sisters or other family members, how successful they have been in terms of perception of a community, how successful they have been in terms of their religion, and so forth, or sports or other things. So everyone at some stage makes this reflection, and they look back at their life. The important thing is that those who are unsuccessful during this particular phase, meaning that they will begin to focus on the negative experiences of their life in the past, and they will feel that their life has been wasted, and they will experience a lot of regrets about their life. These individuals, they will be left with feelings of bitterness and despair. Those who feel proud of their accomplishments, they've had a good career, alhamdulillah, their children are obedient and law-abiding, and they are good members of the society, they may have done well in sports, everyone in their family is happy, then these individuals will have a sense of integrity. The name of this stage is integrity versus despair. So these individuals who would have had successful life, they will feel a sense of integrity. Successfully completing this phase means that looking back with few regrets and a general feeling of satisfaction. These individuals will attain wisdom. They are the ones who will be wise, even when they confront their death. Coping is a very important skill needed in the aging process to move forward with life and not be stuck in the past. The way a person adopts and copes reflects his aging process on a psychosocial level. Social isolation is a major problem of this day and age. Even though the world has become a global village, the entire world is at our fingertips, we may be communicating with everyone else, but not with our own family members. And sadly, these individuals of old age, those who are elderly now, they clearly have not learned to use internet or these social media and so forth. So they are actually in their own little cocoon. Social isolation is linked to loneliness. Social isolation and loneliness can have a significant impact on the quality of life and mental health of older adults, underlining the importance of identifying and reducing barriers to older people's participation in society. In the UK, 10% of people aged over 65, they report that they always or often feel lonely. 1 million older people in England report not speaking to anyone, let alone their family members or their friends, in over 1 month. Older people with weak social ties, they have a 50% higher risk of mortality than those who are socially connected. Social engagement in later life is a protective factor against cognitive decline and dementia, and can influence levels of physical activity, healthy eating, and other positive health behaviors. Changes in socio-economic status, they adversely affect the individual's way of life after retirement. The economic loss is due to a change from salary to pension, and these individuals will now start to rely on their children for many aspects of their life. A feeling of low self-worth may be felt due to the loss of earning power and social reorganization. This state of mind is very harmful, and it only gets worse in coming decades. Up to 60% of older people in hospital, they have existing mental health problems, or they develop them during their admission to hospital. Of people aged over 70 admitted as emergencies to an acute hospital, 50% have memory problems. 27% have what we call as delirium, confused without any idea who they are or where they are. And up to 32% have depression. By 2015, 850,000 people were estimated to be living with dementia in the United Kingdom, with the number expected to rise over 1 million by 2025. Mental disorders, they afflict about 15% of people who are age 60 plus, according to estimates by the World Health Organization. Another survey taken in 15 countries, it reported that mental disorders of adults interfered with their daily activities more than physical problems. This clearly tells us the impact of mental health disorders is greater on an individual than their physical health, for lots of different reasons. Let us briefly touch upon a number of different mental health problems. Depression. Depression is regarded as the most common mental health problem in later life. And a systematic review of research studies found that prevalence rate for depressive disorders ranging from about 4% to over 37%. The prevalence of depression is reported to be even higher in those elderly who live in a nursing home, Figures of between 29% to even up to 40% have been reported across 9 different European countries. Depression is also associated with worse general health. Only a small proportion of older people with depression, they seek treatment. A Center for Policy on Aging review found widespread evidence of under-recognition and late diagnosis of depression in elderly individuals. Although 20 to 40% of older people in the community, they show signs of depression, needing treatment, but only 4% they will actually see a GP, they will see a doctor to seek help for their depression. It was suggested that depression is often seen simply as a part of aging. We think that people who get old, they feel sad. Depression, what are the symptoms of depression? It can present with low mood, withdrawal from social life, reduced appetite, lack of enjoyment from activities that used to give them pleasure, sleep problems, lack of appetite, feeling tired all the time, memory difficulties, and even suicidal thoughts. They don't want to live anymore. They want to end their life due to hopelessness about their future. And old age depression results in the over 65 population having the highest suicide rate. These people, when you speak to them, those who are suffering from depression, they will say very little and probably burst into tears. What they will say, most of it will be either about happy days in the past and that how good their life was, or they may talk about the bleak future and complain about changing nature of younger generations, especially in the sense that they do not give them time they need. These are all telltale signs that this individual is actually suffering from depression. He's not directly telling you, but indirectly, these are telltale signs of depression and despair. Depression in the elderly, it can be treated. However, patients themselves may not say much, as they may feel that this is normal part of aging. It is important for the family to recognize these symptoms and report them to the family doctor. If you feel there is a change in the personality of my elderly relative, do not hesitate to mention this to their doctor. This may be an early sign of depression. The doctor can then make their own assessment and confirm the diagnosis and start appropriate treatment. This has the potential to transform the whole experience in old age, and the elderly person leaves the dunya with happy memories which their family can cherish for the rest of their life. Otherwise, children will remember the harsh and painful memories of this negative experience, which should not actually have been a negative experience. As we age, our brain cells, they begin to decline. They begin to die. The result is in reduced mental and cognitive ability. Memory loss is common in old age due to the decrease in speed of information being encoded, stored, and retrieved. It takes more time to learn new information. Dementia is a general term for memory loss and other intellectual abilities serious enough to interfere with daily life. The prevalence of dementia increases in old age from about 10% at 65 to about 50% over the age of 85. Alzheimer's disease accounts for 50 to 80% cases of dementia. Behaviors which can predict underlying problems of dementia can include short-term memory problems, word finding difficulties. When you're speaking to your elderly parent, the name may not come to them, or they may describe the telephone using a different word and so forth. They are frequently losing their personal items. They cannot find where they put their keys or other items. They may repeat the same question over and over again. You may have told them something 10 times, but they have asked the question again and again. They may be forgetting appointments or mixing up taking the medication, or if they go outside, they may actually get lost. They may also can present with physical aggression or verbal outbursts, and depression and psychosis as part of dementia. Dementia is a progressive disorder which continues to get worse with age. However, Alzheimer's dementia can be treated with medication which can slow down the rate of progression, and patient can have better quality of life for a longer period of time. Other common types of dementia, they include vascular dementia, which is the result of mini strokes in our brain. Although this dementia cannot be treated, but further strokes can be prevented by controlling the risk factors, which include high blood pressure, diabetes, raised cholesterol, and raised lipid profile. And by maintaining a healthy and a balanced diet, by keeping physically fit, and by staying mentally active, they can make significant difference to the outcome. It is therefore important for the family members to maintain a regular contact with their elderly relatives, either it is over the telephone or in person or through other family occasions. Other common mental health disorders affecting the elderly, they are psychotic illnesses. This is really scary. This is when you firmly believe in information which is not true. You believe that other people are trying to harm you, and this may also be associated with what we call as hallucinations, when you may see or hear or smell or feel things on your body which actually do not exist in reality. Psychotic illness, it can cause major disruption to an elderly person and their family. Older people may grow old with an established psychotic illness, meaning that they had psychotic illness through their adult life. Or they can even develop psychotic illness as a new problem in later life. The prevalence of psychosis in older adults is estimated to be less than 3% and has been reported to be linked with hearing impairment, those who have hearing difficulties, social isolations, and some neurological problems like Parkinson's disease. They are at higher risk of developing psychosis. Unfortunately, there is a lack of research on the treatment and service options for this group. Psychotic symptoms, they are, however, much more common, and they can happen in the context of delirium or dementia and depression. This means that sometimes elderly people may present with psychotic symptoms where underlying cause is not psychotic illness, but it can be due to confusion, delirium, depression, or dementia. Psychotic symptoms can really be troublesome, and in most cases, immediate diagnosis and treatment of the underlying cause is needed. Otherwise, the individual suffering from psychotic symptoms may present as a risk to themselves and others. And as a result of psychotic symptoms, elderly people usually become very protective of themselves and their property. They may be calling either the police or relevant emergency services to come and deal with the perceived threat, which actually doesn't exist in reality. They may be calling their family members or telling them about these dangers which are actually not existent. In some cases, these individuals, they become suspicious that other people are trying to poison them, and they will stop eating their food or taking their tablets. And in severe cases, they may believe that there are people in their home and constantly talk about these people. This could actually give rise to a lot of fear, which can result in agitation. It is very important for family members to recognize these early signs and get appropriate help at an early stage. It usually takes a couple of weeks for these symptoms to get worse if they are the result of psychotic illness. If help is delayed, then usually it becomes difficult for these people to engage with treatment at home, and then they usually need an admission into a mental health hospital. If these symptoms are caught early, then most patients can be treated at home without the need for admission into hospital. And if the cause of these psychotic symptoms is an infection, most commonly water infection, then these symptoms will suddenly appear, and once the source of infection is treated, then within days these psychotic symptoms, they will disappear. In either case, it is important for the family to recognize these symptoms and seek help of a doctor. Also, elderly people, they have these other fears of crime in old age, especially among the frail, and sometimes this actually weighs more heavily on their mind than concerns about finances or health, and this restricts what they do. The fear persists in spite of the fact that old people are victims of crimes less often than young people. My dear Islam brothers and viewers of Madani Channel, with this brief view of both physical health problems and mental health problems faced by the elderly, it is crystal clear that old age is full of difficulties and problems. These problems impact on our thought processes and consequently impact on our behavior negatively. Next time, when you feel upset and angry at your parents when they behave in a manner which you feel is odd, please think about this long list of physical health problems. Think about this long list of mental health problems that they may be facing. Allah forbid, if either of us were to experience any of these problems in our young age, we will definitely be much more worse in our behavior. I think we should be grateful to Allah Azza wa Jal in all situations. I am not sure what type of elderly person I will become and how my children will feel about me. Keep reflecting and keep watching Madani Channel. Sallu ala al-Habib sallallahu ta'ala ala Muhammad sallallahu ta'ala alayhi wa alihi wa sallam.
Oh Allah, I beg you to grant my soul its proper taqwa and to refine